Welcome back to DBS and the DFL studio. Tonight we're talking to oncologist Dr. Owen Gabriel and cancer survivor Rufus Bousquet. And soon we're going to talk about cancer. Now, Dr. Gabriel, what is the most common cancer for men, and what are the symptoms of those cancers? I know there are lots of them, but just give us an idea.
So, generally we hear a lot about breast cancer, and for women, and there's an October's Breast Cancer Awareness Month. But for men now, people suggest that prostate cancer is the one we commonly emphasize on. However, in the statistics, global statistics will show that in incidence, that the most common cancer for men would be prostate cancer, followed by colorectal cancer, and then in most cases, stomach cancers. And this is practically what obtains here in St. Lucia. So as far as incidence is concerned, these are the three most common ones. In the world now, more men die of lung cancer, just as the first cause of death for cancer in both men and women would be lung cancer, and prostate cancer would be the second cause of death. And this is also followed in third place by colorectal cancer and so on. So these are the common ones that we see here, but very little information and emphasis is given concerning colon cancer, colorectal cancer, and stomach cancer, and we'd like to talk about some of those tonight. However, if we start off with prostate cancer, which is the most common cause of death from cancer in St. Lucia.
Can I just stop you there? I mean, would you like us to show those images of the cancer
we're
speaking about now?
Yeah,
okay, if we'll show some images as the doctor's talking, but let me just warn the viewers that some of these images you might find, I don't know what's the right word to say. It might make you feel uncomfortable. All right, I don't want to say gruesome or disgusting, because these, it comes from within us. All right, so you may find them very uncomfortable. So when the picture comes on the screen, I will say pictures on the screen, and I'll tell you to turn away, and then I'll tell you when you can come back. All right? Okay, so doctor.
Well, that just suggests that we're not showing these pictures enough, because we want people to be
It's like showing somebody with lung cancer and their lungs are black or something.
That's right.
It sort of discourages you. If smoking is the cause, then you sort of get away from that.
So
perhaps it's good to gross them out,
That's right.
Yes,
that's right.
yes. In saying that, I remember once a long time ago, I took my children's friends to a museum in England. It was a famous exhibition that was going around the world about the effects of lung cancer, and most of the boys, they were about maybe 18, 19, and they were smokers, and I took them there because I wanted to show them how bad cancer was to the internal organs, and they went there and stopped smoking. When you see the state the state of a lung.
Yes.
So as I was saying, we're just waiting for those pictures to come up, but let's continue the conversation in regards to it. Okay, we have our first picture here. So this one isn't too bad, people, but if you don't want to, this one is something you should watch. Okay, so doctor, this picture.
Annually in the US, prostate cancer affects close to 200,000 men, and probably about 30,000 will die every year from prostate cancer. St. Lucia has, these numbers are not so many, but the prostate certainly is a gland that men have, which is located in the pelvis just below the bladder. It's a gland that is made up of fibrous tissue, muscular tissue, and its role is to provide prostatic fluid that will help the sperm form part of the semen, and will help the sperm make its way to the ovary, the egg, and so on.
Okay.
Generally, when a man is born, the prostate is the size of a pea, and as he gets older, he has two growth spurts of his prostate.
Is that what we're showing on the? Can you kind of tell people what it is they're seeing?
That yellow image that you see there would be the prostate, and important to note is that it's right below the bladder, and there's a tube going through it that we call the urethra, and the urethra is that tube that carries the urine from the bladder through and out, of the body. And certainly when you have problems with your prostate, whether it's growth or inflammation or infection, you have urinary symptoms. So you may have problems evacuating your urine, you may have problems with sensitivity, it might be painful, it might have burning sensations because of the location of that prostate with your bladder. So generally, all of these things mean that if you have a problem with your prostate, and there are several things that can happen to a man, not just cancer of the prostate. So you can have, as I said, inflammation, infection. There's such a thing called benign prostatic hyperplasia. And benign prostatic hyperplasia means that the gland is enlarged, it's hard and firm, and this is one of the ways that doctors will examine the prostate by doing what is called the DRE, or digital rectal examination.
That's what the men don't want to do.
Exactly.
That's what scares them.
That's right, that's right. And there's a, there are myths about it, and there's a phobia about it, but it's a common medical procedure that men should have because it's life-saving. If you're able to diagnose a problem with your prostate early enough, then we can do things about it.
How is it examined? Is the man standing up or is he bending over?
Well, usually the man is lying on his side.
On his side.
Okay.
And the doctor proceeds to...
No, but you're laughing at this thing. I mean, I don't see any problem with it as long as you get a female doctor to do it. Just, it's a lot easier to stomach. I mean.
That's another thing. It should not matter. You men are something else.
Well, I'm in St. Lucia, so I'm going to reflect the sentiment of most St. Lucian men. I'm going to represent them here this evening.
Yeah, well, we appreciate whichever doctor that you get to do it, it will be helpful for you. And it's not a painful procedure. It's a very, smooth process. Man comes in, the doctor does this with a lubricated gloved finger, and he examines the entirety of the prostate, its contours. He looks at the consistency of the prostate, its size, the shape, whether there are any protruding masses on it. And he's able to say that, whether you might need further investigation. And further investigation might include your PSA, which stands for prostate-specific antigen, which is a blood test that measures a certain protein that derives from prostatic tissue. And this is a picture, for example, of the enlargement of the prostate, where you see the prostate is, the middle lobe of that prostate is quite enlarged, and that would have protruded into the bladder of that man and caused these symptoms, whether it's obstruction, that he would have to use a catheter maybe to get into the bladder and have him urinate properly. It might lead to, that tendency that the man, when he goes to urinate, that he has difficulty starting urination.
Mm-hmm.
And all of these are signs, and these signs, as I said, are not specific to prostate cancer, but they could occur. And in some cases, we know of people who've had both benign prostatic hyperplasia and the cancer of the prostate. So, there are several things happening in that sense.
Mm-hmm.
When we look at cancer of the prostate, we talk about stages, and with any other cancer, it's similar. Generally, if a cancer is confined within the prostate and you find it maybe on incidental findings, where the person has done a prostatectomy for benign prostatic hyperplasia, we suggest it's a stage 1. By the time that cancer has encompassed the entire prostate, it might consider it stage 2. And when it goes beyond the capsule that surrounds this prostate, and it might go into surrounding tissue, not including lymph nodes, for instance, we say it's stage 3. And once it goes beyond that level and spreads beyond into the lymph nodes, into the bone, metastasized, which is the concept that we use for that, we say it's stage 4. And certainly there are different levels of management of this prostate cancer according to the stage, as with everything else.
Mm-hmm.
And when we talk about colon cancer, we'll see according to the stage, you will see there are different levels of management. So some of these things can include, for instance, and again, prostate cancer has a number of risk factors. The first one that we know of is about your age. So the older you are, the higher that associated risk of having prostate cancer. And these are just studies that I've done in autopsies that you've done on men, who are approaching closer to 80 years old.
Mm-hmm.
Having a family history of prostate cancer is another risk factor. If you have one close relative, your risk is almost double. If you have 3 close relatives, meaning father and brother, you're almost guaranteed into that effect. So as your family members numbers increase, then you also have your risk increasing.
Mm-hmm.
And certainly we've also associated prostate cancer with race. African Americans have been shown to have a higher incidence, and also there's a higher tendency to die of prostate cancer if you're an African American. There are other things like obesity, diet, exercise, and so on, which are associated, but maybe not conclusively.
Mm-hmm.
So these are examples of a prostate that has a carcinoma in the prostate, and you see the different texture of that cancer, and you see these nodules, that clusters of cancer cells within it that you see there. And certainly, once this is identified, there are 4 ways that, or more, there are 4 ways principally that we treat it. And one of these, if the cancer is in the very early stages, we want to do maybe just observation, because if this cancer is a low-grade cancer, in most cases the man would not have any clinical symptoms of it. Just the previous picture would suffice for now, as far as prostate cancer. And as it gets into a lot more important stages, and according to the man's age, according to risk factors, according to his life expectancy, we would proceed to do surgery, which means removing the prostate. And then we could also go on to radiotherapy, which have two modalities. One would be external beam radiotherapy, where radiation, high intensity X-rays, targeting the prostate and killing those cells, and brachytherapy, which is where seeds are implanted into the prostatic tissue, and the radiation is emitted just in the prostate itself. Beyond that, you may have hormone therapy, where both tablets or injections are administered to neutralize the impact of testosterone.
But if you have the prostate removed, that renders you impotent. Would that be correct?
Okay, so generally, traditionally, if you had the prostate removed, there would be damage to the nerves, and there are two nerve bundles that surround the prostate. And this damage to the nerves, these are the nerves that allow for erection and ejaculation. So the damage to the nerves, then you would have erectile dysfunction, let's say. And certainly there are interventions now that are specific enough and precise enough to prevent nerve damage, and that's called nerve sparing surgery, where you reduce the impact of that surgery on the man's ability for sexual viability, let's say.
I mean, I need to go to the break, and I want to say to our viewers, we've shown you the pictures, and the doctor's gone through all of this so that you understand exactly what it looks like and what some of the remedies perhaps are. But when we come back, of course, we're going to be talking about some of the symptoms, because you really need to know, what it feels like, or what it is that you need to be looking out for. All right, and that's what makes this so important tonight. And when we come back, we'll also talk to Rufus about the cancer he has, and how he felt about it and what he's doing about it right now. Now, here's our giveaways tonight. Question 1, name 2 risk factors and the 4 most common types of treatment for prostate cancer. That's 2 risk factors and the 4 most common types of treatment for prostate cancer, to win a free consultation for you and a family member with Dr. Gabriel. Question number 2, the Meguiar's Brilliant Solutions new car care kit includes 7 different precisely selected products to wash, dry and wax your car. Name any 4 of those products. The car care kit includes 7 products to wash, dry and wax your car. Name any 4 of those products and you'll receive this complete car care kit. Last question, provide 3 colors that make up Infinity Color Shop's logo. That's 3 colors that make up Infinity Color Shop's logo, and the winner will be chosen next week for that question, and they will receive $100 off a purchase of $350. When we return, as I said, you know what we're going to do, and then later on we will talk about alternative herbal remedies for cancer. This is DBS and the Law Factor Live. See you soon.